Well, Lohan, thank you so much for starting your week off with us. I'm Ryan Suji, joined by Yanji Denise, and this is Spotlight Hawaii as we continue on in our conversations here on the platforms of the Honolulu Star-Advertiser. Today, Yanji, we have a guest who has made a few appearances here on our show.
Yeah, we've been so lucky to have Governor David Ige with us on so many Mondays here on this program, and he is joining us once again live from his office at the Capitol. Good morning, Governor. Great to see you this morning. We want to get right to the news of last week of the vaccine and those shipping delays because of the weather on the mainland. What can you tell us about vaccines shipments and catching up?
Yeah, absolutely. Thank you, Yanji and Ryan. I really do appreciate this opportunity to be on your program and most importantly, to really be able to engage with the public. We did get a word finally that they are going to catch up on the vaccine distribution this week. So we expect more than 77,000 doses of vaccine. That really represents last week's Moderna shipments, which didn't make it. The Pfizer shipments did make it through. And so we are excited to at least be able to keep the appointments. There might have been slight delays, but for the most part, we'll be able to continue with the vaccination program as we had planned.
So with that many doses now coming into the state, with the state able to catch up on those delays, we did also hear from Hawaii Pacific Health and from Queens on those two vaccination centers that they actually weren't accepting any more new appointments, that they were essentially just giving the second shot to whatever they had left. Does that mean with this new dosage that we can expect to see some of those new appointments be made and sort of work through the tiers, if you will, of people that are scheduled to get these shots?
Yes, Ryan, there was some confusion with some of the centers because we do allocate the second doses that we expect in a given week first, and we instruct all of the centers to reserve that for second doses and make sure that those who are scheduled can get them. Some of the centers just went ahead and scheduled, first or second doses without really paying attention to that. And that really caused a shortage of second doses. And so we did have a couple weeks where we were really in catch-up mode. We stopped taking first doses because there were many who were due their second doses that were not able to get it as scheduled. So, right now on a going forward basis, everybody understands that we want to ensure and place a priority on the second doses. We want those who get vaccinated to get the prescribed intervals of three weeks for the Pfizer and 4 weeks for the Moderna, because that's what the manufacturers are suggesting gives us the best immunity. And so we want to assure the public that we're committed to doing that. And I think once we get through this settling phase and everybody's clear about that, we will allocate second doses that are due in the week first, and then the rest of the doses would be available for first doses.
Judy Keith has a question here. The Lieutenant Governor has been saying the next group will be 65 plus. Another news outlet reported last week, and we saw this over the weekend too, that Dr. Char saying it'll be 70 plus. Which will it be? Are you doing a phased approach where you do 70 and then 65, or does it open to 65 plus next?
No, please just encourage everyone to pay attention to Dr. Char. We're working through. We do know that the CDC has allowed for moving forward with 65 and older, but we have so many individuals in our state that are in that window of 65 to 75. And Dr. Char really felt that it would be better to go to 70 first and then 65 after that. So, people should pay attention to the official announcement from the Department of Health and Dr. Char, because she is the one who's working with the healthcare professionals and making those recommendations. What we're trying to avoid, and you've seen a lot of stories on the mainland with people waiting hours and hours and hours on the hope that they can get vaccinated. We want to be able to schedule our residents. We don't want to have, there's 130,000 individuals between 65 and 75. And if we made it available to all of that, once again, we feel like there would be too many people wanting to get their appointments and not enough slots.
As we see this ramp up of vaccines coming to the island now, and especially if Johnson & Johnson gets that approval, and we could see that also added into the mix, will we potentially see other vaccination centers be set up throughout the state? We know that we have the two at Pier 2 as well as at the Blaisdell, but is there any other plans for another possible center like that, maybe something on the neighbor islands? How will that help as more vaccine becomes available?
Well, actually, Ryan, we have more than 100 centers all across the state that are able to deliver vaccines. And, everybody talks about Pier 2 and Blaisdell Center, but, virtually every community health center is now able to receive vaccinations directly. We're building the capacity so that every pharmacy, it started out with the large national firms, but we really want every neighborhood pharmacy to be able to deliver vaccines, and every health clinic all across the state. So, you haven't heard about big announcements about opening new centers because we really feel like we want as many opportunities for people to get vaccinated as possible, rather than concentrating in a few large centers. As you know, Kauai has been really successful in vaccinating their community without going to these mega centers, and have been working with a wide range of people being able to vaccinate. We think that that's a better strategy. And because there's 100 different locations, we can double vaccinations really easy because everyone has been doing it. They've been getting vaccines. They've been able to schedule and then report the data back, which is really important to us so that we can keep the federal government informed.
While we're on the subject of vaccines, we asked you last time if you had gotten your shot yet. Have you gotten your shot? Surely you count as an essential worker.
Yes, yeah, Yanji, I'm finally scheduled to get vaccinated. I'll be doing it today, in fact. I know people have asked me how come I've waited. Am I hesitant or reluctant? And that's just not the case. I wanted the opportunity for frontline essential workers to be able to get vaccinated. We are like more than halfway through schools, and teachers and all personnel at schools have been vaccinated, and we continue to make progress in that area. And many state and county frontline workers have been vaccinated. So I do believe it's my turn now, and certainly will be getting it today.
I want to bring in another question. This one from Chase asking, are we going to move into Tier 3 in the reopening on Thursday for Oahu? We know that the numbers that we have been seeing have been low and under that threshold for to move Oahu forward into the Tier 3, if you will. Have you had conversations with Mayor Blangiardi and the plans to move Oahu into that tier later this week?
Yes, we've had a couple of discussions with Mayor Blangiardi. I mean, I think we both agree we want to get back to the new normal as quickly and safely as possible. And so we don't want to jinx it, Ryan, and talk prematurely. But clearly, the case counts are trending lower. And, this week is the tail end of the Super Bowl weekend exposure. And just want to thank everybody for making the personal sacrifices, because it's clear that people continue to mask, maintain physical distancing, and avoid parties because the case counts are on the way down.
We wanted to also ask you, following up on something Senator Schatz had said on this program last week. He said that he had been in contact with Dr. Kishimoto along with HSTA through his staff and other, important partners talking about school reopening. His goal, he said, was to try to have schools in Hawaii reopen to in-person learning largely by the end, at the start of the end of spring break. In other words, just a few weeks away. Is that a realistic goal? Do you think that actually could happen?
Well, I mean, I think that it doesn't really make sense to set arbitrary deadlines on these things. I mean, I think, every school is connected to their community. They are talking about, there's mitigation activities that families have to do, taking temperatures, making sure when children are sick that they stay at home. There are a lot of activities that have to occur on the school campus, trying to formulate student and staff bubbles, trying to keep people safe, does require changing virtually everything that occurs on a school campus. And so, we are focused where we see the virus counts coming down. We've had success in making vaccinations available to school-based personnel and really getting people vaccinated and prepared for a return to in-person learning. And so, the schools continue to make progress. I think I'm excited. I think all of our educators really understand that in-person learning is the most effective, especially for our youngest children. And we're all committed to getting students back to in-person learning as quickly and safely as possible.
And just to follow up on that, so do you think at some point, maybe it's not after spring break, maybe it is further down the line, but do you think that in-person classes could essentially happen at some point? Maybe it's the last few months of the calendar year. Do you think that's a realistic goal?
Yes, certainly, Ryan. I do think that that's a goal of everyone, and we're really working hard to make that happen. We are seeing, and it's a little easier at the elementary schools because, the students, for the most part, are self-contained in a classroom, and that creates a natural bubble. Middle school and high school is a lot more complicated because students typically would have, 4 to 7 classes a day. They're changing, there's a lot of transition time to get to the next class. And it just is a lot more complicated in how we keep students, faculty, and staff safe at a middle school or high school, which is easier to do at elementary.
Christine Donnelly, who writes the Kokua Line column, has a question for us this morning. We had the director of DLIR on last week. She said they were actually able to get through some of those PEUC claims. About 30,000 had been processed by the time she spoke with us. But Christine is wondering, will it be possible to ever clear all the pending UI and PUA claims with the current workforce under the current system? The numbers that the director mentioned last week seemed impossible when you look at the math in terms of the pending claims versus the number of staff available to work on them. How much of a priority are you making this, and do you anticipate having to add more workers to try to clear the roles there?
Yes, Yanji, we are trying to staff up to be able to clear the roles. One of the rules that they waived during the pandemic last year was the specific rule to allow us to contract out and hire additional staff. That went away, and we are unable to contract with a call center or others. And so I have authorized hiring for as many people as Anne needs. It is a challenge because we would like to have people with experience in unemployment. That would allow us, especially for the more complex cases, which needs someone to review the information and make adjudication decisions. So, we are committed to staff up as quickly as possible. We have communicated to the Congress and our congressional delegation about the flexibility that we need to help speed implementation of the additional aid for those who continue to be unemployed. But until we get that, we'll have to work within the rules that we have.
We know that President Biden's COVID relief package is making its way through Congress as it goes through those discussions. What have you heard about what is going to be allocated for the state in terms of budgeting? We spoke to Senator Schatz, who said he believes that there may be enough money and flexibility within this new bill and this new funding coming through that would allow to fill some of the gaps that could prevent any sort of furloughs from happening this year. Have you heard anything on that end? And what do you think, and how do you think that this bill would help with the overall budget?
Yeah, Ryan, we have been monitoring the progress of the bill in the House specifically, and we've reviewed the provisions, and if the House bill were to pass, it definitely would provide the resources we need to defer any furloughs. And we would be able to, the language does provide us flexibility to replace revenues and fill the gaps in our budget. And we are hopeful that the Senate will take action. We do know that every Democratic vote in the Senate will be needed. I know that there's been some comments from some of the Democratic senators about not being willing to spend as much as the House of Representatives has, but we are hopeful. If anything close to the House package gets passed, the state will be in a good budget situation, at least for a year or two.
The Lieutenant Governor joined us, and the last time he was here, he talked about possible changes to the Safe Travels program, basically a vaccine passport, if you will, and he laid out some specific timeframes. What's your overall thinking about amending the Safe Travels program to allow for vaccine exemption? He said as soon as March 1st, those CISA employees, who are the folks that were exempted early on, to travel without the testing, could be granted into that kind of a program. And then looking at April 1st for Neighbor Island, and I believe he said May 1st for everyone else. What's your thought on that timeline?
Yeah, I think any kind of timeline or deadline is just premature at this point in time, Yunji. The CDC has not provided any guidance about those who are vaccinated and how they should be treated if they travel. So, until we get official designation from the CDC, we won't be making changes to the Safe Travels program to reflect the vaccinations. Now, we have prepared, we've been making modifications to the Safe Travel program. We haven't put it online, but we are preparing to provide an exemption for those who are vaccinated. It will be a challenge based on the information that's being collected by the national CDC to be able to validate who's been vaccinated and who hasn't. And that's really an important part of the Safe Travels program, being able to verify that those who say they were vaccinated actually were vaccinated by, someone within the healthcare system. So, we continue to prepare. We have a pilot program that was started or should be starting. It should have started last week, but with all the ice storms, I'm not certain whether it has. We're starting a pilot with Common Pass, which would tremendously expand our trusted partners testing network so that it will make it easier for people to get COVID-19 NAT tests. And they are committed to implementing a common passport for vaccinations as well. And so we've been working with them. We are helping them be successful because we know how important it would be to travel to Hawaii and really getting back to the new normal.
We know that there is a bill moving through the legislature right now that would create a uniformed safe travels program where it would not necessarily allow the flexibility that we've seen over the pandemic and the flexibility that you're given to change things. This would essentially put all 4 counties under the same system. We know that there have been pushback, and the mayors that we've talked to, they disagree with this bill and this legislation. What are your thoughts with that bill? Do you think the legislature should dictate this safe travels program? And do you think that's flexible enough to make changes as we know things pop up from time to time that require some changes, such as this ice storm, right? We know that you moved the days to 4 days to accommodate, but with a unified rule under the legislature, maybe that flexibility would not be possible. What are your thoughts on that legislation moving through right now?
I do agree, Ryan. What we're doing is very complex, and every county is different. To assume that the same rules can apply all across the state is just not practical or not workable. Other states have tried to look at the same issue. And if you just look at the needs of Kauai, for example, and as compared to Honolulu, it's just so dramatically different. There are many things that go into the decisions that we make regarding restrictions of travel, as well as mandates that we put in place to keep the community safe. And I think legislating or thinking that you're going to legislate a solution every single time is just not workable during a pandemic, and especially one that is changing so dramatically all the time.
So if that bill does come across your desk and it is passed, will you veto it?
Well, I mean, it would really depend on what it specifically says and how much flexibility may or may not be provided. I do think that, it's hard to explain to people, but it's very different being an advocate for what should be done and being the authority that makes the decisions. The mayors and I speak all the time and wanting to provide passage and travel for someone vaccinated or wanting to be less restrictive on the testing is different for me and the mayors, because our action could result in someone dying if it's the wrong decision made. And it's very difficult to legislate all of the decisions that need to be made. And I think trying to simplify it to say all the rules should be the same across the state is just not the reality that we face here, especially when dealing with something like COVID-19, which started with very little information provided, and we've learned a lot over the last 13 months that we've been dealing with COVID-19. And I assume that we'll be learning even more as variants and other kinds of things come up and we need to deal with.
We know also that going back to the tier system and Oahu potentially moving into tier 3 this week, we have heard that the mayor may also add a few things into that was not explicitly outlined in Mayor Caldwell's version of what tier 3 meant, which could potentially include the allowing for bars to reopen, some sort of youth sport activity to also be allowed, which under the current tier system is allowed in tier 4, but essentially moving that into tier 3. Would you allow for that sort of flexibility, say for bars or youth sports or any other amendments that the mayor makes? Because we know ultimately it still has to come to you for approval. What are your thoughts on any of those types of amendments?
Yeah, Ryan, I have been speaking with Rick, and, we're committed to the same thing, right? We want to make decisions that make sense for our community. It is about balancing getting back to the new normal and keeping our community safe. We're committed to working together. We've had a couple of discussions about that. It really comes down to, can we identify actions that can mitigate the risk of people spreading the COVID-19? And can we work with the youth sports organizations and those people so that they can help us educate the participants? There's a role for the athletes themselves. We need support from the coaches and all of the administrators in the league. There needs to be clear guidance that, whether there's an audience allowed or not, how would we manage that? And really, it comes down to enforcement, right? And how can the organizations help us with enforcement? Because we can't have the police or other law enforcement going in to enforce on these actions. So, I think all of those are involved. Yes, I'm speaking with Mayor Blangiardi and thinking about how we can safely restart youth sports. We can benefit, and we had a real good discussion with Mayor Kawakami, Mayor Victorino, and Mayor Roth, because they've already taken action to allow for sports activities in their counties because their virus counts have been significantly lower. So, that's just another example of why it's important that we continue to have the flexibility. It wouldn't have made sense for youth sports to occur on Oahu anytime earlier because of the virus counts. But because Kauai, Maui, and Hawaii Island have been able to proceed, we do learn, and we can identify things that can mitigate the spread of COVID and really allow it to happen in a safe way. They've been doing weddings on the neighbor islands now in a safe way. They've restarted conventions and meetings in some of the neighbor island resort areas as well. And so I think that helps to inform us on how we can do it in a safe way here on Oahu. We know obviously there's a lot more travelers here, and we know that there are a lot bigger resorts. And all of us working together allows us to be better and serving the community.
On the subject of the neighbor islands, the rule as it stands now is that if someone from Oahu travels to the neighbor islands, they have to have a COVID screen first, but not the other way around. If Oahu does in fact move down to that tier 3, has there been any discussion among the mayors about lifting some of the travel restrictions for inter-island travel?
Yes, Yanji, we are definitely talking about that. And, I'm glad, I'm a little surprised, but obviously glad that the case counts on Oahu have come down so quickly. Just 2 weeks ago, we were keeping our fingers crossed about whether we would be able to get to tier 3. And, the last week, 10 days, the virus counts have been focused in a downward trend, it's consistently for now almost 10 days. And so that's really encouraging. It really does tell me that our community has made the personal sacrifices in order to control and manage COVID-19. And, I am excited. I'm optimistic. I do believe that we'll be able to get to tier 3. And then, Mayor Blanchard and I will be working on those difficult questions about how do we balance for youth sports? How do we create a system that can protect the participants as well as the community? And I think most importantly, how do we allow us to get back to the new normal in a safe way?
Beyond just the pandemic, obviously, you are looking forward to planning what the next few years looks like for the state. And a lot of that was detailed in your State of the State address. What are you looking and what are you doing to help plan for the economic recovery? Because we know just as important is the health of our community, so is the economic health. And the reports and projections moving forward often look grim for some of the industries like tourism. What are some of the efforts that you're doing? We know that the Hawaii 2.0 effort is something that you have sort of put on the table. Is there anything specific that you can share with us about the efforts that you are looking to do to help the economy rebuild moving forward?
Well, clearly, Ryan, it's got to start with the hospitality industry. It's the largest sector. It employs the most people, and we have to be focused on how to get trans-Pacific travelers here safely. With the new variants, all of the international origins really shut down again because of the concern of the new variants. And, we are in dialogue with Japan and South Korea. We know how important Canada. We do know how important those 3 major markets are for international travelers. And we know that international travelers tend to spend more than the average traveler to Hawaii, and it would be really important for our economy. So we are focused, we working with the industry to get the employees vaccinated. We know that allows us to keep workers as well as travelers safe. But we need to make an effort when appropriate to bring back trans-Pacific travelers, because that will start the cash flow. It'll start back people getting back to work and getting more people back to work. And then it's really about what changes do we envision. Ryan, you were with me when we took the Senate paperless a while ago, and what a fundamental difference it's made. What the pandemic has taught us all is to really embrace digital technology. And if you don't, you can't be successful in this new digital economy. So how do we help all the businesses? What does that mean? How do we, keep the lessons learned in the pandemic, contactless ordering and delivery of groceries and all of those kinds of things really does help our community be better. Which of those elements do we keep as an ongoing? And I think more importantly, how do we get all of our businesses to really fully embrace the opportunities and the challenges of the new digital economy? I think that's the question we want to answer in Hawaii 2.0. And does it change the priorities that we've been talking about for the last 5 or 10 years, or does it accelerate some of them?
Okay, well, our time is running out, but before we go, I know, Governor, you said that you're getting your vaccine today. I have to ask, are you going to be televising or live streaming that? And then if you have any other final thoughts for us this morning.
No, I don't think we're planning to televise or live stream that, but I do want to
take a picture. You have to.
I will take a picture. I did want to thank the people of Hawaii. The virus is still raging in many communities across the country, but it really has been on a real good trend here in the islands. It's very clear that people have made personal sacrifices. They avoided those Super Bowl parties 2 weeks ago, and it really has helped us be leading in the country in our COVID response. So I really want to thank everyone. Vaccinations are on its way. I just want to assure everyone that we're prepared. We are committed to delivering vaccines in arms for those who want to be vaccinated as quickly as the federal government is making it available. And I do see us getting to the new normal before the end of the year. You know, those we've seen the polls that talk about those who want to get vaccinated, and I'm really inspired that everyone understands why it's important to be vaccinated. And I really do want to assure everyone that we're committed to getting people back to work and getting the economy going in a way that is healthy and safe for everyone. So aloha and mahalo.
All right. Thank you, Governor. Take care.
you.
Aloha.
Well, always great to hear from Governor Ige, and some news today. Obviously, he's sharing on a personal note that he will be getting the vaccine. Also making some clarifications. There was some confusion as to what part of the population will be allowed to get the vaccine next. He did say that we should focus on what the Department of Health has to say. Dr. Libby Char saying that those over 70 will be allowed to get the vaccine up next. They will open that up. And then good news, as he pointed out at the end, that we're going to get over 70,000 doses this week to make up for the doses that we missed last week.
Yeah, so good news there as people continue to wait. We know that there is a large demand of people, and that was sort of put on hold because of the recent storms that were happening on the mainland. But Governor saying that they are making up for that, including the shipment that was held back, as well as the new shipment that is coming out. So a large number coming into the islands, and he's optimistic with the way that those will roll out, that they will be able to, again, service more people through this new 70,000 doses that are coming in. We also heard from him about some of the in-classroom learning that could potentially happen, that we could get students back into the schools. He did not specifically say a date, but he did say that it is a real possibility that there could be some form of in-person learning for students by the end of the school year.
Yeah, and he also expressed some daylight between him and the Lieutenant Governor when it comes to projections of timelines on the safe travel changes. He did say that they are moving forward with trying to figure out what that would look like, but until they get final authorization from the CDC and guidance as to whether or not vaccine passports, if you will, should be accepted, they're not making any changes. And the other thing that he did point out was that it's going to be difficult for the state to verify if someone did indeed get a vaccine, and that will open up a whole new, set of work, basically, that they have to figure out how to verify vaccine.
Yeah, but we did hear that there could be some sort of changes with the neighbor island traveling, and that may be an opportunity where if we continue to see these case counts here, especially on the island of Oahu, drop, that the pre-travel testing that is required for those Oahu residents going to a neighbor island, that could potentially be lifted. And he said that those discussions are happening with Mayor Blangiardi, including moving Oahu into Tier 3. He said he doesn't want to jinx anyone, but again, the numbers here for the rolling average on the island of Oahu is at 27 right now. And again, 50 is a threshold to move into Tier 3. So it looks like, unless there is a large, substantial number of cases that are reported over the next few days, that Oahu will be moving into that tier system. But the question remains, what other changes will be made to accommodate some of the things that the Blangiardi administration wants to now include into Tier 3?
Right, because remember that the tier system was outlined by Mayor Caldwell, and Mayor Blangiardi has expressed a more pro-business and a more relaxed attitude towards some of the restrictions. He did say, on this program, that he does want to make allowances for bars and youth sports and other industries. So we'll have to see what he outlines. Probably on Wednesday would be when we would hear about that. Coming up on Wednesday, we have Mufi Hanneman from the Hawaii Tourism and Lodging Association and Jeff Wagner of Outrigger Hotels to talk about the tourism industry, to talk about safe travels, and to tell us how things are going from that perspective on a business standpoint. Obviously, that industry is very battered and beleaguered, but it is sort of the economic engine of our state. So how is it doing, and how do we rev that back up? We'll be discussing that.
And then on Friday, we're going to be talking to the organizers of Movers and Shaka. It's a program that was started to help bring remote workers here to the islands to help cover some of their expenses and costs to have them work here in Hawaii while also doing community service. We're going to talk to them more about the program, the pushback that they've been getting, but also the extreme interest. Over 90,000 people applying to be a part of that program. So we're going to talk to them more about what they're seeing and what they're hearing from people who want to work remotely here in the islands and how that is impacting local residents and their perspective of the program.
Yeah, so please join us on Wednesday and Friday. Until then, have a great week. Thank you so much for spending time with us and the governor this morning. Have a great day. Aloha.
We'll see you on Wednesday.